need that residents in the 23 counties actually are in need of. And Elijah Muli, head of disaster management at the Kenya Red Cross, is here to have that discussion with us. Elijah, I'd just like to pick your mind on how bad the situation is, because I know Red Cross, you have been doing a lot of humanitarian aid in some of these affected counties.
Yeah, so thank you very much. And as you know, we haven't reached the height of the drought yet. As you know, the peak of the drought is usually end of August, the whole of September. So if we are talking about 2.1 million people at risk currently, then definitely we expect this number to increase significantly as we get to the peak of the drought.
And just listening to the CS for Devolution, Wamalo right there saying that by December things could get worse. And the country started talking about drought from the month of March until May this year. Looks like nothing has been done, like not a lot has been done to try and alleviate this affected Kenyans.
Well, as you know, there is what we call the integrated phase classification. And this is now the continuous assessment of the food situation status in the country. And as we speak right now, and I think it has been very clear that we are in the alarm stage. Remember, we moved from the long rains, the March, April, May. The conditions there were in IPC 1, IPC 2, and is at this stage where we are saying now the early warning has been, rung that we need to take action. But I think there's a lot of effort that has been happening, and the disaster we are facing here is climate-induced, and there is very little that can be done to be able to mitigate what would happen, from the climate scenario. We can only anticipate and prepare.
But then, truth be told, Elijah, this is not the first time Kenya is talking about drought. Every year, you're talking about the same thing. So does it mean that the government is not doing enough to try and finally bring an end to this? It's like talking about, heavy rainfall every year. We're expecting heavy rainfall, heavy downpour. Families are affected. Now, again, we're talking about issues to do with drought. 2.1 million Kenyans are affected. Well,
I think as we know, the bottom line, or what we are talking about is a foundation of a populace that has a lot of burden, including the poverty levels. We have the effect of pandemic and many others. So it requires not just a one-time event, but a continuous and cumulative actions towards preparedness, towards changing the mindset, appealing to attitude, and stuff like that. So there is quite a lot that I can attest to that is happening, but there's still more that will need to be done. Yeah.
So does it mean like Kenyans also need to change their perception in terms of diversifying the food basket?
That is for sure. Quite a number of things need to change. People need to look at, what we call climate resilient practices. We need to look at our dietary, needs. And also in terms of the preparedness and building the resilience to the communities, we also need to identify options that are doable. They need to be able to understand what are some of the sustainable food sources, what are some of the sustainable livelihood options that are not climate vulnerable, but that can be able to withstand, these adverse effects of climate change.
All right. And COVID-19 looks like it has worsened the situation. Because when I look at the relief web that also does a lot of humanitarian aid the same way you do at the Kenya Red Cross, it goes ahead to say the COVID-19 pandemic has further worsened the situation by restricting access to health and nutrition services, a slowdown in trade and losses of income and livelihoods due to measures put in place to control the spread of the virus. And finally, it goes ahead to say that between March, and they're talking about March and April this year, Kenya came through a third wave, which was the fastest growing and the highest number of people infected since the beginning of the pandemic. However, since the beginning of June, the COVID-19 positivity rate have started increasing again, and a fourth wave of increased COVID infection is looming as we speak right now, Elijah. So when you're talking about COVID-19 pandemic, you're talking about a drought, then that means we are expecting the numbers of reported deaths to be higher than the previous years, because there's lack of access to food, balanced diet for the infected Kenyans, and also there's lack of access to health facilities. Then now here comes drought, that even the 2.1 million Kenyans cannot even, afford to put food on their table to try and fight COVID-19.
That is for sure. And one of the things that helps a population to be able to cope with emergencies or with shocks is the ability to withstand. And one of the ammunitions that a community would have is the financial muscles, the options that they would have. Mm-hmm. So when you look at COVID-19 pandemic as a disaster in the country today, it has significantly reduced mm-hmm. the options that those at risk would have. Markets have been affected, trade has been affected, and many other options. We know very many people who relied on small holding, be it market-driven or even livelihood production activities, have been affected. Mm-hmm. And this will definitely impact on the ability to be able to cope with other emerging issues, drought being one of them, and there are many other mm-hmm. emergencies that we are dealing with in the country. In
fact, I remember when you're talking about other emergencies that we're dealing with in the country, you've reminded me of the locust invasion that just happened. And it was really heartbreaking on how farmers were crying on the sort of losses that they were having. But away from that, Elijah, let's talk about the national and the county governments, the coordination that they have in terms of releasing available funds to work in close cooperation with development and humanitarian partners like the Kenya Red Cross. How has that been when it comes to fighting hunger here in the country?
I think if we look at the last few months, and where we are now, I think at the time when we have seen the nation coming strong on issues like drought, I think this time around it has been very strong. And this shows and confirms that there has been a concerted coordination system or mechanism that is in place or it's improving. Mm-hmm. Because right now you can see, and we are lucky and we thank God that we have not witnessed any loss of life as of today, human life.
So out of the 2.1 million who've been affected, no reported case of death has been reported as we speak?
At least from where I see it, from where Kenya Red Cross sits, mm-hmm. we don't have a reported case of life lost as of now. For the livestock, that could be a different story, but human life, we have not seen that. And mm-hmm. therefore, we have seen now of everybody coming around the table to talk about it, to call for action. I think this is already a testimony of a concerted effort and collaboration and partnership that mm-hmm. is critical to be able to have the impact that is required.
Mm-hmm. I like that you're saying that there's that effort to have a sit-down, a roundtable meeting to try and find a lasting solution. But I believe as a humanitarian organization, there's several challenges that you're facing, even as you try to reach out to the millions of Kenyans who've been affected by drought.
For sure. I think one of the critical challenges that we would have is the millions or the multiplicity of needs that are required and that require the attention of the humanitarian actors. So that is one. And of course, in the absence of what is required to be able to sort out the burden of need, definitely we expect humanitarian actors to be, limited in terms of actions. And this is not just the humanitarian actors, but even the government. Mm-hmm. I think that the priorities are many. There are many things that, come into play. And the resource factor mm-hmm. is one of the drivers of vulnerability mm-hmm. in the country.
And talking about vulnerability, Elijah, women and children are the most affected, because we are talking about, and especially nursing mothers, we're talking about, loss, child mortality rate being high. So what is the Kenya Red Cross, together with the government, doing to ensure that when the country is talking about drought, for the affected Kenyans or the Kenyans, the 2.1 who are about to face the drought situation here in the country, are well taken care of so that we do not report any case? Because you've said, from where you sit, no case has been reported of deaths due to drought.
Yes, that is for sure. And I think what is happening right now, when we talk about a 2.1 million people in the alert stage, that already tells you that there is need for response now. Mm-hmm. And what is happening right now is being able to save lives, being able to provide the requisite support that is needed. The requisite support here would span from food provision, water, being able to look at, the options that are available to be able to put food on the table. That is number one. Then number two is being able now to be able to give the information to the people at risk at the right time for them to be able to take action. And this will also be able to cushion them in terms of capacity of information, in terms of them knowing that we are not yet at the peak of the drought, in order for them to be able to, whatever little resources could be available, can be directed to what is critical and what is needed.
And when I look at the statement, not really a statement, but a study that was done for the Kenya Red Cross Society, which said that 2.1 million Kenyans are currently facing high acute food insecurity, up to 1.4 million in February due to a worsening drought situation. And the picture you've painted for us is more like this is the early stages of warning that we are treading on a dangerous ground. And definitely, I believe the Kenya Meteorological Department also, the weather forecast, they give it on a daily basis on how bad the situation is. So who do you think is failing the country when it comes to, fighting drought, the drought situation here in our country? I know this is such a difficult question for you because mostly the Red Cross, you deal with humanitarian assistance that's needed.
Yeah, for sure. And maybe just to make a correction, I think the biggest work of the Red Cross is in the long-term development work. 75% of what we do is towards building resilience. Probably what is audible is the response actions. But yes, what you're saying is very true, that the effect of climate change and also some of the climate change, impact, is something that needs to be on the table all the time. So what is happening is to be able to integrate and mainstream, climate action, lens in all the actions that we do. In whatever we do, for instance, when we go into planting, for instance, we are waiting for the October, November, the October, November, December rains that are coming. We don't have any indications of a better season as of yet, even though the official forecast is not yet out. But when communities are preparing themselves to go into this, planting season, then we need to mainstream the knowledge that this season may not be as good as would be expected. So they should be able to plant crops that would be able to withstand, rains that are not the normal rains that they usually receive in those areas.
All right, but then just try to make me understand. Because, we had Kenyans for Kenya trying to raise funds. Every year we are seeing humanitarian organizations like Red Cross calling for help, calling for Kenyans, calling upon Kenyans to try and help fellow Kenyans in need. So, and some of the things that I can see Red Cross does mostly is doing boreholes, wells, water pans, and also trying to ensure that farmers within the arid and the semi-arid areas do farming that somehow goes are in tandem with the weather forecast. So why is it that every year we are still, talking about drought in the same counties that humanitarian organizations like yourself help? When coming up with a lasting solution.
Well, I think we have a lot of ground has been covered, but the journey ahead is still long, because here we are talking about dealing with foundational issues. We are dealing with, we are in the third world country, and the basket that we have of resources is limited. For you to be able to turn around things requires time, requires significant investments, not investment in terms of infrastructure, but also investment in capacity, investment in, empowering, those that are subject of our actions to be able to take their own actions. And this requires time. And I can't say really that there has not been effort. There has been baby steps toward the right direction.
And finally, as we bring this conversation to an end, let me just ask my director for a minute, because I know we need to take a short commercial break. Kenyans keep on wondering, why does humanitarian organizations like the Kenya Red Cross bear the most responsibility when it comes to disasters?
I really wouldn't want to say they bear the most, but I would say they are critical players and partners in this, because being in the humanitarian space, then we got to do what we got to do. And what we got to do is to complement the work of the government and those that are, the responsibility bearers to be able to support and make our contribution. And that is what the Red Cross does.
All right, all right. I was asking you that because most of the time we see Red